Everybody, Dr. Zach here, the Spine Health Clinic of Chiropractic. So today we have our friend Nicole here, and what we're going to be doing is going through a series of adjustments to show you exactly kind of what it's like at a Spine Health Clinic of Chiropractic. So one thing that we do differently than most other chiropractors around here is I'm a strictly Gonstead practitioner, and what that means is what we're about to show you. At Aspiring Health, what we do is it's very individualized care. When you come in, we sit you down, and every time you come in, we're going to give you all of our attention. We're going to focus specifically on your problems to get you the solutions and the results you're looking for moving forward. So today, in this part of the video, what we're going to do is we're going to scope. And as you guys know, in the past, I have a couple other videos out there. We use this instrument right here. It's called the Nervoscope. And what this instrument does is it picks up heat. As you can see, this little meter moves here. And where you find that heat is on the person's back. That's why they're wearing this fashionable gown right here. It opens up in the back, and that allows us to use this instrument here to pinpoint exactly and precisely where the inflammation is coming from, or in other words, where the nerve pressure is, or in other words, where your problem is stemming from. So we use this instrument to figure all that stuff out. So today what we're going to do is I'm going to have you spin around, please, and going to go ahead and figure out where some of these problems are coming from. So here. So as we go down the spine here, the needle's going to move left and right, and essentially what we're looking for is going to be kind of like a little bit of quiver. Like the needle will go left, and it'll go right, and then it will kind of wiggle like this a little bit. And that allows us to basically pinpoint exactly where that problem's coming from. So in this case, have a little bit of pressure right here. So now what we do is we go back through 5, 10, and then count out specifically where we found those nerve pressures and what corresponding vertebra we marked here. And then basically the next step, what we're going to do is we're just going to figure out where they're located, and then we're going to move. This is called motion palpation. And based on how this vertebra feels and how it's moving is going to give me what I need to know in order to correct it properly. So some vertebra, they kind of move more to the left or more to the right, and based on that motion or that pattern, that's going to allow me to cue in specifically on how to correct the vertebra. A lot of people see chiropractors kind of just pushing forward and crunching and cracking bones. That is not necessarily the goal here. What we do is very specific, and we want to move bones a specific direction in order to have the best possible result moving forward. So we have our marks here, counted all of those up. I'm going to continue to motion palpate and figure out the proper corrections moving forward, and then the next steps we're going to correct these. So thank you.